Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 28, 2025. This video is in a special article in the Annals of Internal Medicine published recently titled Alcohol: Is Any Amount Safe for Health? Alcohol and Cancer Risk, the Emerging Consensus. The 2025 Surgeon General said alcohol is the third leading preventable cause of cancer in the US. The causal link to 7 cancers: breast, colorectal, esophageal, liver, oral, pharyngeal, and laryngeal. The risk increases even at less than 1 drink per day, especially for breast, mouth, and throat cancers. Debunking the healthy alcohol myth. Modest alcohol consumption is not cardioprotective. Recent studies adjusting for confounders found no benefit. Avoid misleading patients with safe drinking level myths. Clinical counseling, informed and personalized. Abstinence best for avoiding alcohol-related harm, but not the only reasonable choice. Avoid judgment or blame in counseling decisions. Explore amount, timing, and motivations to uncover risk behaviors. Call for better labeling and risk communication. Current alcohol labels in the US are inadequate. Proposal includes serving size, servings per container, calories, and clear health warnings. The Canadian approach: risk presented as a continuum, not binary, safe or unsafe. Tools and resources for risk estimation. NoAlcohol.ca, a Canadian web app for patients and providers, estimates risk, calories, and cost of various drinking levels, supports shared decision making with real data. Evolving public attitudes. Abstinence, increasingly viewed as normal and not stigmatized. The shift in sociocultural norms may reduce alcohol-related harm. Panelists are optimistic about future messaging and evidence. In fact, just recently there was a Gallup poll which showed US drinking drops to new lows. And this was published in the New York Times on 13th August. Only 54% of US adults reported to be drinking alcohol, the lowest in Gallup's 90-year history. Decline steepest among middle-aged adults between 35 and 54. and the decline is from 70% in 2024 to 56% in 2025. Majority now believe 1 to 2 drinks daily harms health. Youth drinking continues to fall. Only 50% of the adults between the age of 18 and 34 report drinking. Cultural shift. The sober curious and the mindful drinking movements are rising. Health concerns, pandemic effects, and cannabis substitution all play a role. Alcohol-related deaths doubled between 1999 and 2020. This calls for cigarette-style warnings on alcohol products. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.